Hi, I'm Richard Nahas. I'd love to share a paradigm shift in healthcare with you. I'm the president of the North American Academy of Neural Therapy. And neural therapy is a unique way of treating the human body because it targets a unique lesion. They call it an interference field. You might think of it as a blockage. And what I'm inviting you to do is to think about an entirely new way of understanding human anatomy and physiology and diagnosis and treatment, focused on these lesions where you've injured yourself in the past from a fall, a fracture, a surgical procedure, places where a scar has resulted in sensitized nerves, in restricted connective tissue, places you can learn to feel in your patients, places you can learn to inject with targeted local anesthetics and dextrose and regenerative therapies, and places you can learn to release using an assisted stretching technique. This is an entirely new way of thinking about why your patients have pain. You'll learn very specific skills like tapping and touching to elicit a stress response in these scars, allowing you to examine your patients along myofascial chains, recognizing that when they fell on an outstretched hand, even though they may have fractured their distal radius, the force that traveled up their arm created a lesion perhaps in their AC joint or in their TMJ, perhaps in their thoracic cage, depending on the angle they fell at, perhaps in their SI joint. These lines of force in the myofascial matrix are the new anatomy that will help you deliver exceptional results and see the body in a whole new way. Come learn with me. You will not see the body in the same way again.